Hi, my name's Katie Mitten. I'm the new SafeKidsAustin Coalition Coordinator. I joined the team in September of 2021 and immediately saw how dedicated the SafeKidsAustin members were to making sure that all of the kids in the greater Austin area are able to live, grow, and play in a safe way. As you'll see in this report, despite the challenges of COVID, our members were able to accomplish some great things. I hope you'll enjoy watching this report and that you'll join me in thinking about what we can accomplish together in 2022.
The SafeKidsAustin Board of Directors serve as advisors to the Coalition Coordinator and help guide the Coalition. The SafeKidsAustin board members include 3 executive officers and 5 at-large members. In 2021, our board president was Stephanie Trevino, vice president was Alyssa Magrum, and Johnny Humphreys was our secretary. Our 5 members at large are representative of the Coalition's general membership and our community. We are extremely grateful to our board members because the success of our Coalition is due in large part to their leadership and commitment. The mission of SafeKidsAustin is to prevent serious unintentional childhood injuries and fatalities in Travis, Williamson, and Hayes counties. Our vision is to create communities where children can live, grow, and play safely. To accomplish our mission and vision, we promote changes in attitudes, behaviors, laws, and the built environment. We facilitate community partnerships, advocate for policy change, raise public awareness, provide education, and distribute safety resources in an effort to prevent unintentional childhood injuries and fatalities. Dell Children's Medical Center is the lead agency for the Coalition. While the hospital serves a much larger area, the work of SafeKidsAustin focuses on Williamson, Travis, and Hayes counties. SafeKidsAustin has 5 pillars that guide our work: data, education, awareness, advocacy, and membership. The first pillar of our work is data. We use data to determine where we focus our Coalition efforts and resources. According to the Center for Disease Control, over the last 20 years, the leading cause of death for children under 1 year old in the SafeKidsAustin region is accidental suffocation and strangulation in bed. For children in our 3-county region between the ages of 1 and 4, motor vehicle crashes and drowning are the top causes of unintentional injury death. We see the same leading causes of unintentional injury death for older children, those ages 5 to 14. With motor vehicle crashes and drowning being the leading causes. Another set of data our Coalition uses to determine where to dedicate our efforts and resources is the Dell Children's Medical Center Trauma Registry and the Submersion Registry. It is important to note that the Trauma Registry only includes patients with a traumatic injury that meet certain criteria. The Trauma Registry does not include patients who were treated and released from the emergency room, nor does it include patients who were treated for other types of preventable injuries, such as suffocation or poisoning. The most recent data we have is from 2020 and shows that falls and motor vehicle crashes continue to be the most common types of injuries seen by the trauma team at Dell Children's Medical Center. Here you can see changes in the Trauma Registry data from 2019 to 2020. Red and yellow signify an increase in the rate of injuries over the last year, and green indicates that the occurrence of that mechanism of injury has decreased. Restrictions due to COVID had an impact on the types of incidents seen at Dell Children's Medical Center. 2 examples. First, we saw an increase in the number of bites. This includes things like dog bites and insect bites, which were likely a result of children spending more time at home and outdoors. Second, we saw a decrease in sports-related injuries, likely because group sports were less common due to COVID restrictions. Male children were more likely to be seen by the trauma services team at Dell Children's. The most common types of injuries seen by trauma services at Dell Children's varied by the child's sex. Males were more likely to be seen for bike or penetrating traumas, while females were more likely to be seen for injuries related to motor vehicle crashes and falls. Children between the ages of 1 and 9 make up nearly 70% of the trauma patients at Dell Children's. The top mechanisms of injury seen at Dell Children's broken down by age are identical to those present in the data from the Center for Disease Control over the past 20 years. The second pillar of SafeKidsAustin's work is education. We educate professionals, community members, caregivers, and children through community events, media interviews, professional trainings, educational materials, and virtual trainings. SafeKidsAustin is a data-driven coalition. Based on the national and local data just presented, our primary focus areas will continue to be promoting child passenger safety to prevent serious injuries and motor vehicle crashes, supporting safe biking and walking, increasing access to water safety education and resources, and promoting safe sleep through education and distribution of safe sleep resources. In 2021, our members distributed car seats and booster seats through contactless distribution events. We used virtual media opportunities to educate community members, conducted a child passenger safety technician course to certify new technicians, and created new engaging safety tip cards and signage. Our members also participated in the statewide Office of Disability Prevention for Children conference, held virtual help desk where parents and caregivers could get tips on how to make sure their children are riding safely. We adapted our Safe Baby University to a virtual format, and we opened the new Simply Safety Center at Dell Children's Medical Center. The third pillar of our work is awareness. As a coalition, we work to raise awareness in our community about preventable childhood injuries. The second annual National Injury Prevention Day was an important opportunity to spread awareness about the impact of preventable injuries and ways we can make sure children are safe in our community. Dell Children's Medical Center lit their tower green in recognition of the day. And the City of Austin recognized Dell Children's and the SafeKidsAustin Coalition members for their continued commitment to preventing childhood injuries during a press conference. Despite COVID-19 limiting community outreach, SafeKidsAustin members conducted awareness through various virtual means. Through over 30 news and radio segments, we spread awareness about the prevalence of unintentional childhood injuries and the ways we can all keep kids safe. Through social media, we had over 17,000 unique impressions. The fourth pillar of our work is advocacy. Our members advocated for safer communities in many different ways, including written and spoken testimony at the state legislature, letters to federal elected officials, and advocating for local recognition for National Injury Prevention Day. The fifth and final pillar of our work is membership. This pillar is extremely important because without our members, none of our work would be possible. In 2021, the majority of our members represented government agencies or nonprofit organizations. As the pandemic continued to impact the ability of the coalition to engage members in person, we looked for new ways to support our members. We launched a new member listserv and a member-only Facebook group to ease communication between members. We held all of our bi-monthly meetings virtually and saw an increase in attendance and engagement. In 2022, we are committed to diversifying our membership and continuing to improve our support for our members. Each year, we honor and recognize organizations and members who have gone above and beyond to carry out the mission of SafeKidsAustin. The SafeKidsAustin Friend of the Year Award recognizes a SafeKidsAustin community partner organization that has consistently and notably supported SafeKidsAustin in achieving our mission and vision throughout the year. The SafeKidsAustin Service Award recognizes organizations or individuals for their significant contribution to SafeKidsAustin and the greater Austin community throughout the year. The SafeKidsAustin Coalition Champion Award recognizes a member who has consistently supported the SafeKidsAustin coordinator in coalition activities and initiatives. The Coalition Champion demonstrates dedication to the coalition and regularly provides assistance to the coordinator to achieve coalition goals. The SafeKidsAustin Ambassador Award recognizes a member who embodies the mission and vision of SafeKidsAustin. This member is committed to creating a safer community to prevent childhood injuries by leading injury prevention initiatives in the Austin area, frequently collaborating with and assisting other members with injury prevention programs or activities, and providing materials, resources, or assistance to other members when needed. Thank you for listening to this report, and we hope you'll stay connected and get involved with Safe Kids Austin.